Hello, my name is Mark Laslett, and it is a great pleasure to introduce the new structure of my course, Diagnosis of Persistent Low Back and Referred Lower Extremity Pain. There are about 200 conditions that may present as low back pain. This course takes the clinician with at least some practical experience through an intensive program of instruction in the art and science of identifying the source and cause of persistent back and referred lower extremity pain. You may have heard or have been taught that it is not possible to make a diagnosis as to the source and cause of back pain in individual patients. This course will demonstrate that that is simply not true and rejects the outdated notion that 85% of back pain cases should be classified as non-specific. Ask yourself this question: if diagnosis is not possible, how is it that we know there are 200 possible causes of back pain? This course will show you when a diagnosis is necessary and when it is not. It will provide you with the evidence that supports and demonstrates that it is possible to make a diagnosis in the majority of cases. The course will systematically lead you through a process of how to make a diagnosis and provide you with the evidence on just how accurate that is. At the end of this course, you will know what your error rate is and what to do about it. You may have been taught that making a diagnosis is not helpful for the patient, the clinician, or for the general well-being of society. This course rejects that notion and proudly adopts the position that ignorance is not bliss, rather that information and knowledge is power. In this course you will systematically explore the individuality of cases presenting with back pain. The course is about the individual patient, not about the economics, epidemiology, or politics of health. This course takes the approach that the next patient entering your clinic may have a condition that is resolved with simple advice and reassurance, or may have a complex condition that has more than one cause and is confounded by psychosocial distress, depression, frustration, or anger. The next patient you see may have the most common type of back pain, or a condition you have never seen before. This course accepts this clinical reality and can teach you how to take control of that uncertainty and to thrive in it. It is accepted that we cannot make a diagnosis in all cases, but knowing what the diagnosis is, or that a diagnosis is not possible at this time, can be empowering to patients and clinicians alike, when approached in the right way and delivered in a positive, empowering manner. There are two broad approaches to clinical medicine generally, and painful musculoskeletal disorders in particular. They are the public health approach and the individualistic approach. The public health approach uses evidence on known risk factors, mean or median values for pain, distress, disability, and costs to determine how most clinicians can act to improve the overall condition of populations. Thus, things like avoiding bed rest, remaining active and employed, being positive, eating well, exercising more, and smoking cessation are the cornerstones and foundation of care. It is a broad brush approach that has the potential to lower the incidence and frequency of episodes of back pain and reduce the economic and social costs of sickness, disease, and disability. The individualistic approach is concerned with patients, specifically this patient, that patient, the next patient that comes to you seeking understanding, relief, and prevention of a condition which is currently bothersome. In the case of lower back pain, this individual presentation may be a consequence of a disc derangement, facet joint arthritis, sacroiliitis, nerve recompression, spinal stenosis, a blocked artery, cancer or a fracture. The presentation may be because of severe disabling pain, making ambulation difficult or impossible. On the other hand, it may have been prompted by mild backache but grave concerns about arthritis or cancer. These approaches are not in competition. They are not mutually exclusive or even jointly exhaustive. They are simply different types of concern and different fields of inquiry and action in response to a known issue. The issue here is that back pain affects most people at some time in their lives and is the greatest cause of musculoskeletal pain and disability affecting modern societies, and that you, me, your mother or brother will likely have back pain and want to be seen as an individual. The clinician managing individual patients may also be involved in the wider issue of public health as I am. The public health official needs individual clinicians who can treat individual patients, but is also aware of the wider implications of pain and disability. This course is for clinicians concerned with individual care. It is concerned with understanding and discovering the source and cause of pain in individual patients. Epidemiological evidence is an important starting point for the science of diagnostics, but not the end point. This course will train you in diagnosis by subtraction, whereby you will use epidemiological facts and the new science of diagnostics to rule in and rule out possible causes of pain, then help you understand the confounders of both diagnosis and treatment in individual cases. I have been an instructor of courses for over 30 years and seen the education process morph over this time from ex cathedra eminence-based systems advocated by charismatic gurus to a potential for careful, reasoned processes utilizing different learning styles and deeply respecting high-quality research and evidence supported by the latest technology in presentation. In this course, all claims are either supported by quality evidence or acknowledged as opinion or speculation. All lessons are in the form of audio-enhanced PowerPoint presentations that appear to the student as videos that may be paused, rewound, and repeated as many times as is necessary. No more does the student have to choose between listening or taking notes, only ever hearing 50% of the material at most and forgetting 90% in a month. Access to the online material, both lectures and case studies, extends over many months, and even then may be extended for a nominal cost if required. Online quizzes allow you to test your understanding. This course has been in existence for 2 years as an extended training program in New Zealand and a modified, somewhat shortened version in North America, Europe and Scandinavia in 2017. This experience, with great feedback from course participants and those close to me, has stimulated restructuring of the program so that it is more accessible to clinicians who must juggle time and cost commitments in busy lifestyles that include work, play, family, and continuing education. It remains a master's degree or clinical doctorate level program that in the last 2 years could only really be undertaken over 9 months in New Zealand. The new course is now broken into 3 online modules and 1 practical seminar module that may be completed in a year or spread over 3 years. The course is founded on my own research and over 45 years of clinical experience, the latest evidence and research findings from the past that remain relevant. I now have a large store of videoed case studies of the assessment and sometimes treatment of common and rare conditions. This video bank of cases is being added to all the time. I also have an extensive store of detailed but not videoed case studies that come from my own clinical research. The course is best suited to those who are good time managers with self-discipline to engage in study outside of a formal classroom environment. Enrolments are open from mid-September 2017 and will remain open for a month. There is a maximum number of enrolments our current online system can accommodate, so if you want to start upgrading and developing your diagnostic skills, contact Rachel, Southern Musculoskeletal Seminars Administrator, immediately. Email info@musculoskeletal.courses and Rachel will send you a detailed description of the course and costs. Module 1 will commence formally in early October 2017. You can view some more information on our website www.musculoskeletal.courses, and you may follow and interact with me on Twitter @marklaslett_NZ. Thanks for your attention, and I hope I may meet you on a seminar day sometime in the near future.